Want to learn more about what it takes to prevent homelessness? Check out the Canadian Observatory on Homelessness series, Prevention Matters, an online panel series that hosts approachable, research-based conversations on what it takes to address homelessness at its root causes. The series exists because if we want to address homelessness through prevention, we must be clear on what prevention means. What can we do to reduce the chances that someone will experience homelessness in the first place? What can be done to support people who are at high risk of homelessness or who have recently experienced homelessness? To delve into these questions, Prevention Matters invites researchers, service providers, and lived experts to tell us about how prevention looks in their work, along with the lessons they've learned along the way. Check out their series at preventhomelessness.ca/prevention-matters for insights on prevention for Black and Indigenous communities, the role of community relationships, tenant organizing, and more. That's preventhomelessness.ca/prevention-matters for more information.
You're listening to On the Way Home with your host, Michael Braithwaite.
Welcome, friends of the On the Way Home podcast. I'm your host, Michael Braithwaite, and I work at Blue Door, an incredible organization working across the top of the GTA in York, Durham, and Peel, doing life-saving, life-changing work. I work with 150 frontline heroes and managers that day in, day out are helping people on their housing journeys, whether it's emergency, transitional, supportive, are helping them integrate into the community. We help them on their healthcare journey with, we have a nurse on staff, some doctors that help us out, etc. And we have a social enterprise called Construct, which launches people into the trades where they make a living wage and pulls them into poverty, prevents homelessness, that and much, much more. Go check out the cool work we're doing there at bluedoor.ca. We've just started a Housing for All Community Land Trust to try and secure land and homes in perpetuity at deeply affordable rates. So we're doing that. Some developments. We knocked down a tiny house. We're putting up 14 and we're working through the funding on that. That's come down and you'll see that go up. Check it out. We're always looking for new partners and friends. And listen, on this podcast, I get many of my ghosts. I don't have any ghosts, hopefully. I have many guests that are suggested by listeners. Right? People reach out and say, I want to be on. I talked to this person, you should have them on the pod, etc. Would love your suggestions, even for improvement. If you're a fan of the show, or maybe you're not a fan of the show because we can improve it, reach out to me at michael.b@bluedoor.ca with your suggestions around guests. You do intros to guests. You can be a guest yourself. You know, I'm so inspired week in, week out by this podcast, by the brilliant people that come on that are doing cool stuff, life-saving stuff. They're rising to the challenge. They're, funding issues and all that kind of thing. They're pushing past it to help our most vulnerable with some really cool and innovative stuff. So I encourage you to reach out. Again, michael.b@bluedoor.ca. Hey, today's guest, it's all about healthcare and housing today. We have Carolyn Dyer from Reach, in Niagara. And Carolyn has been in healthcare for the past 15 years and is executive director of Reach Niagara. And they do super cool stuff. They've got a mobile unit going to 22 sites. Niagara is huge. It's a little like where I'm from, York Region. The region's really, really big and spread out. So they're all over supporting the most vulnerable people across Niagara. They're doing all sorts of cool different programs. They're starting up a new one called Streets Soon. And we talk about how it all came about, what they do, why it matters, what the data is showing them, what some of the challenges are with servicing vulnerable populations. If money wasn't an issue, what would you like to see happen? And so on. We just talk about how healthcare, a lot of healthcare, they get prevention, policing gets prevention, but homelessness, for whatever reason, still seems to be stuck a little bit in the reactionary mode. Now, we've had Dr. Gates and Melanie Redmond, two of our nation's top experts in youth homelessness prevention, on recently, and they talked about that too. We're trying to change that conversation, and this is what Carolyn has seen as well with healthcare and housing, and we talk about that overlap going forward. It's a wonderful conversation. Housing is health, health is housing, and it is so evident in our conversation with Carolyn that she's passionate and her team are really making a difference for our most vulnerable and servicing people that sometimes fall through the cracks in our healthcare system. I should not say sometimes, very often, right? So let's go to that conversation now. I think you'll enjoy it as much as I did. Carolyn, thank you so much for making the time today to join us on the show.
Thank you for having me.
We ask the same question to everyone, and it's very personal to each guest. And That first question is always, what does home mean to you?
Yeah, it's a great question. Home to me means the sense of belonging, feeling welcomed in a space, not necessarily this physical structure, but yeah, where people feel that they are welcomed and that they are valued in their home.
Well said. Yeah, people, it's never about the physical structure. It is that feeling, right? Whatever that feeling is to you. You have an incredible background. I'm hoping you could walk us through some of the journey into your current work.
Yeah, absolutely. I've been in healthcare my entire career. Haven't got sick of it yet. It's been about 15 years, and I started actually in public health and, got a taste of our hospital system. So I got to do a project there. And then since that time, I've been in primary care. And most recently, the last almost 2 years now, I've been with Reach Niagara. So really focusing on healthcare for community members who really need us most and really would struggle otherwise without Reach.
Yeah, I mean, good for you. For 15 years, you are, many would say, a survivor of the system. It's a tough time, always has been, to be in healthcare. You're doing life-saving work, changing things under the most trying of circumstances, often, I think, understaffed and underfunded. So we're so grateful to you and all the others that are working so hard. Talk to me a little bit about Reach. What is it and how did it come about?
Yeah, great question. Reach really started as a grassroots community organization. It started from a community member and a local family physician who were seeing the impacts of folks who were experiencing homelessness and the fact that they had no access to healthcare and, no access, being able to go to even a walk-in clinic and then not feeling safe or welcomed in our hospital care system, which is a sad reality for many. So they started to Reach, just the two of them. And we started in one single shelter. And then from there, over the last few years, we just have really taken off. We got a cool mobile health clinic in 2021, and that really gives us that flexibility to quite literally go to where people are. And it makes our model really unique that we can be mobile and very flexible. And then here we are today, 22 sites. If you're familiar with Niagara, we are very geographically spread and we are servicing majority of our communities. It's a real testament to the team with the work that's being done, but also sadly speaks to the need. We always say we actually wish that Reach didn't exist or didn't have to exist, right? Because we have grown so much because of the need that we're seeing as it relates to those experiencing homelessness or, other social risk factors.
Yeah, and I think more and more the healthcare system is understanding that you can't always expect people to go to you. You have to go to them, right? We've seen that in our area with South Lake Hospital, which is wonderful. They've done a strategic plan where they've realized that their community outreach has to grow and doing the things you have. Yes, in Canada, healthcare is free. We have a healthcare system, but it's not easy. It's not equal access to all. And we saw that during the pandemic as well. If you mapped areas of people who were the most sick, you saw it in a lot of lower income neighborhoods where access wasn't the same throughout. What are some of the partnerships that projects you're involved with or leading right now in Niagara?
I think our most recent one that I'm personally most excited about is called Welcoming Streets. So that's a program that, we've seen across many areas and communities in Ontario, but new for us in Niagara. So it's a partnership with our local harm reduction agency, so Positive Living Niagara, and the city of St. Catharines. And quite literally, we're trying to create a welcoming street. So community members, regardless of social status, feel welcomed in neighborhoods, that, you're creating this sense of well-being. And again, to your point, Michael, it's the outreach component. So having a dedicated team that are out there walking the streets, engaging with community members, doing a lot of business engagement too. Because, we're hearing overwhelmingly, businesses are struggling and not knowing what to do, truthfully. And wanting to help. So this is a really good answer and a new initiative for us. So we're going to be piloting it starting in March with our team, and we'll see how it goes, fingers crossed. And then from there, hopefully consider expansion to other areas.
It's incredible what you're doing. I wonder if you're free to share. What is your funding model? Because I'm sure that's always a challenge. You want to do more, but who's going to pay for what, et cetera, right?
It's I feel it's our ongoing struggle, truthfully, is we don't have base funding. So often folks will think, well, your healthcare, you must get money, right, from their province or the Ministry of Health, and we don't. And we're really hopeful, truthfully, that will happen over the next few years. But right now we rely on a number of creative solutions, from local donors, various grants. But that's challenging, right? Because they're often short-term in length. You're doing hard work. You're asking staff to do really hard work where they may not have a job in a few months. And then we're supporting folks who have experienced unbelievable things and such sadness in their life. And, they share your story with our frontline staff, and that takes a lot. It takes a lot for someone to do that. And then a few months later, they may not be there, that staff member, because of funding. And I share that because we re-victimize people as a system. And I think we undervalue why it is so important for that consistency when we're talking about individuals who've experienced, significant traumatic events in their life, that we're not having to have them tell this story each and every time. So we're very hopeful that maybe, people will see value in this important work we're doing for our community members, and be able to have something a bit more stable.
I would guess that you'd have some stats around, like, so we're in the same boat as you. Blue Door's taken on different healthcare initiatives, and when we first started doing it, none of it was paid for by government. So it was TD Challenge money, it was others, and it's still not paid for by the province, who's responsible for healthcare. However, we kind of work on that. Let's prove it, right? So if we're just, I don't know if you're saying that, but we're just trying to prove it. So we're keeping a lot of stats. So we'll talk about, hey, we've cut down at most shelter sites. The only response you have for healthcare is someone comes to the desk and says, I'm experiencing pain in one way or another. You call 911, they dispatch fire, EMS, police, and then they come there and they kind of do which they take them or not. Very expensive, very traumatizing. As you said, telling the story 3 times before they get to the hospital, and then not having that physician. But we built it. And we've seen that just by having a nurse on site, we've cut down on those calls 50%. We have an in-reach worker within a hospital that instead of being discharged, they go to see the in-reach worker who links them to not just Blue Door, but any service and that they need. And we've seen some great stats around that. What are some of the things that you've seen as a result of your actions?
Yeah, I mean, data speaks volumes, right? And so we're in the exact same boat. You're speaking our language, I feel here. Is we collect a lot of program data. So last year, we look at, we've serviced close to 4,000 community members. I was just looking at our data. Majority live below that poverty line, so about 19,000. Majority are unsheltered. And last year we started collecting the number of ED visits that we prevented too, right? Because as you just described, ED visits, there's a cost associated with that, and very expensive. And that's not even assuming someone gets admitted, right? And we know there's so much evidence around the fact if you're experiencing homelessness, you're going to have essentially 14 days potentially in hospital compared to someone who is housed who would have 7 days. Like, there's so much evidence with that. So we've been collecting that data too, to show the cost savings to a greater system of why it's important you invest in healthcare in your community. But again, considering a model that is unique for those, again, who are experiencing homelessness or other social factors, because in the end of the day, our current traditional primary care system is not designed for individuals who don't have a health card, can't keep an appointment.
Let's dig a little deeper. Sorry, let's dig a little deeper on that. Because I want people to understand exactly that. So the healthcare is what are some of those differences? We've heard it. We had a gentleman a couple of years back. He was a true street doctor. Like, he worked on the streets out of Boston. It was pretty cool. Like, he was a retired physician, and he talked about it. He said, you don't really it's not the same as treating kind of your everyday clients, someone who's
Mhm.
unhoused or in deep poverty. Can you talk a little bit about that? Like, what are some of the things that you would see that would be a little different, and how would their needs differ from your kind of day-to-day patient?
Yeah, it's such an important understanding for just general community to understand that. So what we see when I think of like when we're inside some of our shelter sites is there's so much going on in people's lives. Like even if we think about it in the simplest sense, they don't know where they're going to sleep potentially that night. They don't know when their next meal is going to be. And chances are they don't have a health card, truthfully. There is no such thing as time or anything like that. And so for a lot of the folks that we see, we're there for them in a moment, whatever they may need too. And that's an important aspect as well, is people come to us and they end up just telling us all these things that they've been experiencing for over a year because no one's listened to them. So we end up seeing in a visit, 3, 4, 5 different issues that we're trying to address in that moment, because truthfully, we may never see them again. Versus in your typical practice, right? Often it's, 1 to 2 issues kind of per visit, right? All those pieces, but not for the folks that we're seeing, because again, they've had so many other competing life priorities around just having basic needs met, that these issues that they probably have had for a while have just compounded and gotten worse and worse. And then they finally get to us and we're like, holy cow, there's a lot going on here, right? And how can we do as much as we can in this moment? Because again, we may never see you again.
I think that's important too, is that and we wanted to talk a little bit about preventative work, right? The earlier we can get to treat people, the more often we can get to treat people, so they're not, when they come in to see you, they're not in a state of crisis, right? And it seems that we understand prevention when it comes to crime or the environment and that kind of thing. But it's weird around homelessness. Most of our time is spent on reacting. What are your thoughts around that?
I think that's spot on. It's very reactionary, our system, which is, again, I think why REACH essentially exists, because we're responding to multiple needs that have been neglected for a very, very long time. And we don't, I came from public health, and I think in my public health days, prevention is essentially the cornerstone of public health. Yet we don't adopt that same principle quite as well, truthfully, in other healthcare settings where we are trying within the past 6 months, we actually formed a relationship with a local agency that provides services to young moms who are finishing their high school education and the alternative education school, where we provide counseling and primary care on site to these youth. And we're doing that as a way of prevention. So how are we helping people earlier on in their journey to try our best just to mitigate some risk factors that would predispose them potentially for homelessness? So again, trying to take a bit of a proactive approach, because we see that in other sites where it's very reactionary, where you just wish, what happens if we could have seen you, even 6 months ago, what a difference that would have made.
Yeah, prevention is huge. And I think you've got actually some of the most, someone doing some of the best leading work in the country, and Mike Lethby at the Raft. He does a lot of work around going into schools, his programs there that he's done both in Niagara and Hamilton. And then he's been a pioneer of the upstream program as well, right? Just working with people on that prevention end of things. And we see it, right? I mean, the stats are, for someone experiencing homelessness without a doctor, they're using the ER as their primary care, right? Like when they go, and I remember reading a stat that someone who's unhoused would go to the ER 5 times more than someone who's housed, probably more, because that's when you don't have a doctor and you don't have, and that's just easiest, kind of not easiest, but the most convenient for them is I just go to the ER when things go sideways. And it's not all equal. We just opened our operating site in Beaverton Heights, which is in North Durham, and we're really jazzed about it. And one of the things we didn't think about, the whole community of Beaverton for years has been without healthcare. Like it really is. So now we have higher needs people in a transitional program that when they come to they're going hours to Aurelia, and then
Wow.
trying to work with the system to get them back. So lots of challenges in smaller towns as well. What are some of the challenges that you've had in doing the great work that Reach has done over the years?
I think some of the challenges that we've had is not having that secure funding. I mean, that's a no-brainer, right?
Yeah.
To have that guarantee of your frontline staff. And I think that's an important piece of the Reach model too, is we try to be a one-stop shop in collaboration with partners. So, we have case managers, we have outreach workers, we have counselors, we have peer services, and then we partner closely with a number of family physicians. And so that's a struggle, right? That's a big challenge, knowing that what will happen with that. I think another challenge that we've experienced, particularly post-COVID, and not many folks are aware of this, is if you do not have a valid health card, this took effect April 2023, you have to pay for services. So you have to pay to get blood work, to go get any form of, diagnostics and x-ray, whatever it may be, go to the hospital. And I don't think people realize what a barrier that is for folks. Just even being able to show up, but then asking people to pay for this, that's just simply not a reality. So that barrier, though, we've really considered our model, where we now started to offer point of care ultrasound, which is the coolest thing, that we can do that in real time for folks, right? That the physicians can offer that service for people, that we can do blood work in real time for folks. But again, that's a big barrier when we talk about, accessing healthcare in Canada. As to your earlier point, Michael, we are in a fortunate system, but there's still opportunity for equity, because it is not equitable for people. And that's a big piece with the health card. And then finally, I think, the biggest challenge that we're seeing is just, sadly, this stigma and stereotype. It has really become a strong narrative over the last little bit, which is why, again, we're always looking for a solution to a problem, why we're doing Welcoming Streets. Because we want to engage with businesses, we want to engage with just general community members to really help having conversations where we're not, assuming or placing judgment on people automatically because we see they're unhoused.
Yeah. Well, there's a lot of well-meaning businesses out there. I'll tell you a quick story. We were running this Out of the Cold program at a new location. It was at a church in East Gwillimbury, and it's a pretty isolated. And so in the morning they had to leave at 7 a.m. So they'd go down to Tim Hortons, was the closest thing. So we'd have 30 people hanging out there, and then they come back at night. Right? And the owner, fantastic person, was like, look, I want to support. I'm all for help me understand, help me through this, because they're basically taking over the restaurant and
right.
The washroom and everything. And I don't want to be that guy, but it's hurting business. So we work with them, and now we have a day drop in, and so you do different things. But again, you have business people that are saying, look, I don't want to be I'm not looking to be mean or cruel, or I'm not looking to pass judgment, but I'm struggling with how do I support? And it sounds like Welcoming Streets is going to be a great way to help some of them through that.
We're really, really hopeful. I think of a few things that businesses have said, and it's valid. They didn't sign up to be a social worker. We've had businesses say that to us. But again, because of, the toxic drug, honestly, supply out there, layered on with, this homelessness crisis, is businesses are we're hearing, I don't know what to do, and I'm almost at kind of my wit's end, where we're losing that compassion and empathy, to what you just described, Michael, where you're early on to say, hey, let's have a conversation about this, because I genuinely want to help. But because, though, so many things have been happening over the last little bit, businesses are kind of like, okay, what do I do now? I'm over this. This is impacting, in the end, their bottom line, right? So we're just really hopeful with this opportunity with Welcoming Streets to bring back that sense of community. And I think also for us to have conversations with community members who maybe reside in the downtown core. There is so much misconception, and then you have a conversation with someone, you're like, okay, I hear where you're coming from, right? But we don't take that time to talk to people, right?
No, it's almost an automatic kind of reaction. I think we need to have conversations. And there's people that are, I support you, but I have these concerns, and
Yeah.
I have these, I want to support, but, and that's when that tells you so it's open for a conversation. There's a guy, Ryan, out of Chicago. He's known as the homeless librarian, and he goes around and actually educates and helps libraries that have become daytime drop-ins for
Wow.
many people that are vulnerable, and helps them work through some of the challenges of stigma and those pieces. Because again, not social workers. However, um, you know, uh, they do have to, they are frontline, like first contact, right? So he's
Yeah.
done that. And it's amazing. We were talking, I remember, at one point with a major bank about how instead of putting security guards in their bank vestibules, and sorry, in like the ATM
Mm-hmm.
spaces, that when they, give something to like a program like yours to work with the banks, and the bank, wouldn't it be a great community thing to say, you don't want people sleeping in bank vestibules. They don't want to be there either. Let's find them a home, right? This shouldn't be someone's home, but it is, and we want to support. What a great message for banks. We didn't get anywhere with it, but it was good. It was
Mm-hmm.
there, and those are the kinds of conversations you might have. So let's talk about the future for Reach. If what are you looking at? What are some up there? You've got your this program. What are the next few years looking like? What would you love to happen? And let's just say funding wasn't an issue.
Funding wasn't an issue, eh? Wow. Dreaming big here. I think we're doing a lot of really cool programs. So yes, I talked about Welcoming Streets, but we're also doing this new program through some short-term funding from the Health Canada for folks who are transitioning out of our local detention center. Because that's another audience that are very neglected. We've learned so much through that already, and that's another program where I think, wow, it's only short term, but we're anticipating, if we were to dream big, that we would want to be able to continue that, continue to expand with our mobile, get a second mobile. Our mobile, I mean, it's pretty phenomenal. Our mobiles at 22 sites, like we're so busy, like there's just not even enough time in the day anymore operating one mobile. So being able to expand, and I think for us too, we've been really talking about how can we almost service, subpopulations of those experiencing homelessness. So, those that identify as cis women compared to those that identify as cis men, it's a very different experience. They're very different. So much data speaking to like life expectancy is very different. Risk factors are very different. And that is an area where we're just starting to dip our toes in. But we really would love to have some dedicated program recognizing the difference in that gender experience and being able to service appropriately based on that.
So cool. There's a group in Ottawa, Shepherds of Hope, I think, and it's really cool. They did a whole floor of a housing building they had. They did a floor and turned it into healthcare. And I remember Deirdre, who was there at the time, she's not there now, saying I think they could work it out that they were saving the province $2 million a year in healthcare costs. Right. So like, I mean, not only is Reach is saving lives, changing lives, but you're saving the system a ton of money, right? So it's a win-win-win all around. So I do hope that people see the value in that and hopefully you'll get some stable funding. If people want to find out more about Reach and what you do and follow you on social media, that kind of thing, where can they go?
Yeah. So our website is reachniagara.com, and then we're on Instagram, Facebook at reach_Niagara, and welcome anyone to follow us. We do a lot of education pieces. We share a lot of evidence, not just about Reach, but just in general, because I think as a community, we all should have a bit of a commitment as part of our learning, particularly what we're seeing every single day. So it's a great site. I'm biased, but it's great to follow.
Amazing. Well, thank you for all you do. I got to tell you that Niagara, of course, is my hometown. I grew up in St. Catharines, so I always have a lot of pride when I see incredible programs like Reach. There is another Braithwaite operating in the Niagara area, the Hope Center. So he's doing great work there. And so Mike Lethby, there's so many good things that are coming out of Niagara. So thank you to you and the team for the life-saving work you're doing. And thank you so much for taking time out of your busy schedule to join us on the show today.
Wonderful. Thank you, Michael.
You're listening to On the Way Home with your host, Michael Braithwaite.